The greatest immediate danger to students with diabetes is hypoglycemia. That's low blood glucose. Remember how it sounds. Hypo, low. The other thing you need to remember is that many times hypoglycemia cannot always be prevented. Be alert for a range of possible signs that something's wrong. Different students can have different symptoms. They may be lethargic or irritable. They may feel weak or unable to think straight. They may be combative, and they may start sweating. Hypoglycemia can come on suddenly without warning. Students can get tired or start feeling ill for any number of reasons.
Test your blood sugar.
No, I'm fine.
Are you sure?
If they're doing sports, they can sweat. But if they've got diabetes, you need to watch for any change in behavior or appearance. Hypoglycemia can be unpredictable. The student's condition can deteriorate very quickly. If not treated promptly, they may have a seizure, trouble swallowing, or they may faint. Be familiar with the student's low symptoms and treatment as contained in the Diabetes Medical Management Plan, and know where to find the student's low blood glucose supplies. Fruit juice, glucose tabs, or regular soda can deliver 15 grams of fast-acting carbohydrate. Your job is to intervene and treat before the student's condition worsens. And remember, a student experiencing hypoglycemia should never be left alone.
But that guy told me to pick it up.
Hypoglycemia can come on at any time, not just during sports. Sometimes the signs are not going to jump out at you.
So why haven't you
But
found
again,
him yet?
if you've got a student with diabetes, keep an eye out for the red flags. Watch to see if she's sweating or feeling weak when she shouldn't be, if she loses interest or looks pale or sleepy. Clammy skin can be another sign. But the main thing to look for is the change in behavior. A minute ago, the student was focused and looked fine. Very suddenly, though, she's lost interest, and she looks just
I'm
out
fine.
of it.
You have your meter in your purse?
It's in my locker, but I'll be okay.
Stay right there. I'm gonna get you some juice.
Hypoglycemia can sometimes affect the way people think. So don't expect the student to know what's happening or even be cooperative. If you don't have a blood glucose meter, treat for hypoglycemia anyway. After a hypoglycemic event, kids need time to rest and recover. Because people with diabetes don't have enough insulin, their bodies can't move glucose from the blood into the other cells. The glucose builds up in the bloodstream. High blood glucose above target range is called hyperglycemia. To help you remember, think hyper, think high. Any number of things can cause hyperglycemia. It's possible that the student has forgotten to take insulin or hasn't taken enough. The student may have eaten more than planned. Food raises blood glucose levels. Stress, inactivity, or illness can also cause hyperglycemia. Among the signs are thirst, tiredness, dry skin, and stomach pains. Also fatigue, the inability to concentrate, and frequent urination are signs of hyperglycemia. Whatever the cause, you need to know how to recognize hyperglycemia. This is important.
Hang on a sec. Hang on just
While hyperglycemia should be avoided and treated in all students according to the Diabetes Medical Management Plan, which may include giving insulin, it is important to know that the onset of hyperglycemia comes on more quickly in students who experience insulin pump malfunctions. You're not expected to be a doctor, but when you have a student with diabetes and you notice that something's wrong, you've got to take action. Blood glucose monitoring is the cornerstone of diabetes care. Students should check their blood glucose before meals and snacks, and when they experience symptoms of either low or high blood glucose. However, not all students check before snacks. Blood glucose target range is individualized for each student and set out in the student's diabetes medical management plan. Many students can monitor their own blood glucose. Monitoring means using a lancet device to prick the skin at the fingertip, forearm, or other site to obtain a drop of blood. The drop goes onto a strip that is inserted into a meter. The meter shows the blood glucose level. Some students may need a nurse or other trained staff to do the checking or help the student check. Blood glucose monitoring is perfectly safe. Test strips can be disposed of in the trash, and the school nurse should work with the family to plan the best strategy to dispose of the sharps. Some students may wear a continuous glucose monitor, referred to as CGMS. It continuously monitors blood glucose levels through fluid in the tissues. CGMS can be useful in detecting the onset of hypoglycemia and hyperglycemia and monitors blood glucose patterns and trends. However, CGMS is not a substitute for fingerstick checks. Blood glucose levels should always be confirmed with a fingerstick check before any treatment or action is taken. Students need to be able to check their blood glucose anytime, anywhere, and to have equipment always available. It helps them to treat promptly, avoid the complications of diabetes, avoid unnecessary missed classroom time, and helps them become more independent. Severe hypoglycemia, low blood glucose, can be very serious. Hypoglycemia takes place when insulin and blood glucose are out of balance, and this can be caused by a number of factors. Too much insulin, not eating enough food, too much exercise, or eating late. The student may lose consciousness. She may have seizures. She may be unable to swallow. If that happens, never try to give the student food or drink or put anything in the mouth.
Jaren, go get some help.
A student experiencing hypoglycemia should never be left alone.
Call 911.
Someone else needs to call for help and call 911.
Hi, I have an emergency at my school. My friend has diabetes and she just passed out.
For cases of severe hypoglycemia, the school nurse or other trained staff need to know how to administer glucagon. Glucagon acts directly on the liver to release stored glucose. The glucagon kit needs to be where school staff can get to it. Position the student on her side and administer glucagon. The student should wake up in 10 to 20 minutes. She should drink fruit juice and a snack in accordance with the diabetes medical management plan. Check blood sugar levels every 10 to 15 minutes until emergency personnel arrive, and until the student's back to her target range, according to her diabetes medical management plan. Keep checking until emergency personnel arrive. Keep a close eye on the student. She may not even remember what happened. She may experience nausea, vomiting, or headache. That's okay. This is normal. Glucagon is a life-saving treatment that cannot harm the student.